The Healthcare Security Cast is sponsored by 3D Network Technology. Reliability is our core value. Visit www.3dnetworktechnology.com. And by Genetec, delivering security strategies for healthcare. Visit Genetec, that's GENETEC.com. The Healthcare Security Cast would also like to welcome our newest sponsor, the Change Execution Group. Visit 360lifetransformations.com.
Welcome to the Healthcare Security Cast, the podcast dedicated to healthcare security, safety, and emergency management. If you are involved with a healthcare security program or desire to be, this podcast is for you. Join the conversation as we discuss the issues that matter to healthcare security professionals while leveraging the expertise of healthcare security thought leaders and experts in personal development. And now, here's your host, Brian Hamilton.
Welcome to the Healthcare Security Cast for Tuesday, July the 28th. Today I'm joined by Scott Hemingway. Scott, thanks for joining us today.
My pleasure.
And I always like to start off by learning a little bit about who we're speaking with. So who is Scott Hemingway?
Sure. So my professional career started with the Rhode Island State Police. I did that for 23 years. I retired in 2008 as a lieutenant. During my career, I was on the SWAT team, the dive team, hostage negotiator. I ran our governor's security unit for 4.5 years. I was an instructor at the academy. And December 23rd, 1989, I'm a critical incident survivor. I was involved in a shootout as a result of domestic. And then on top of that, in June of 2013, I got out of the United States military. I was an MP my entire career. My last assignment was with the 243rd RTI, which is a regional training institute. Every state has one of them. So I taught the basic military police course, cell extraction, combatives, less than lethal force, land navigation, that type of thing. And when I retired from the state police in 2008, I was hired by a company called APG Security, based out of New Jersey. They were looking for a healthcare security director for a significant healthcare organization in Rhode Island called Lifespan. Rhode Island Hospital is a 950-bed hospital. Attached to that was Hasbro Children's Hospital, and they also had Miriam Hospital, Newport Hospital, and Bradley Hospital, which is the oldest inpatient juvenile psychiatric hospital in the country. So I got my feet wet, pretty quickly with the Joint Commission, CMS, behavioral health patients, all that type of thing. And then in 2010-ish, 11-ish, APG was hired by Stewart Healthcare, which is a pretty big healthcare organization. And I oversaw the first 13 hospitals, their hospital integration policies under one enterprise security program. And then lastly, in May of 2018, I left Lifespan and started my own security consultant firm, the Hemingway Group. We do a lot of risk assessments, healthcare specific, active shooters for healthcare, armed intruder, a lot of workplace violence stuff. And then I got headhunted, and I'm currently the security director in parking for Brockton Hospital Signature Healthcare. So that's a little bit about Scott.
Now, we touched on your career quite a bit. I'm just curious, what was it that really has attracted you to healthcare and kind of kept you within the healthcare industry?
Sure. So when I first interviewed with APG, I was excited about the opportunity because they were having a pretty significant amount of employee and staff injuries in the emergency department and the behavioral health unit. And they knew my background, and they thought I could be some assistance to them and maybe changing or modifying or come up with a new program. A lot of the programs in healthcare are like CPI or MOAB or safety care, handle with care, they all have their positives and sometimes they all have their weaknesses. And I think with CPI, part of that weakness was the physicality portion, where the acuteness of the violence that we were seeing with our behavioral health patients and CPI didn't really match up, where CPI kind of fell short a little bit with giving staff and security a higher level of personal protection skill sets that could get compliance from that particular patient quicker, more effectively. And the quicker you do that, you reduce their time or the likelihood of an injury to either staff or even the patient themselves. So that really piqued my interest. As I got more and more into it, the more and more I felt, honestly, that I could improve the safety of the patient and, just as important, our staff, making that environment a safer environment. I had a little personal stake on that because my daughter is a psychiatric nurse, so she's right in the middle of it, and I thought for sure if I could help that and improve on that, and we saw a reduction in staff injuries. We saw a reduction in the amount of mechanical restraints per quarter. So we had some success with it.
Excellent. Now, when you were making that transition, I guess, from the law enforcement and your military background into healthcare, were there any mentors or influencers who helped you get to where you are and kind of guided you through that process of making that transition?
Yeah, sure. So at Rhode Island Hospital, the director of security for the Lifespan Corporation was a gentleman by the name of Anthony Vulcan. Anthony was a retired Providence police sergeant. So when I interviewed with him, one of his statements to me were, listen, this is the civilian world, and the process of change sometimes it takes much longer, and you'll find robust, passionate opinions on each side of that spectrum, and your goal, if you can, is to kind of bring that into the middle somewhere where everyone feels comfortable. And that's when he said that thing, don't let perfect get in the way of good. And that really resonated with me because sure enough, as I started to go in these committees and began to make recommendations about some changes and why and things like that, not that there was pushback, but there was certainly some hesitance from the medical staff side, and they looked at it from, you're from the law enforcement side and the military side. It's different here. And I understood that, and I think if you're not aware of it, you could take that and become defensive a little bit, if you're not comfortable with them saying that to you and taking that for what it's worth. They're not an indictment on your career or anything, but it's just a different perspective from the healthcare industry where it's customer centric, and certainly they want to make sure that it's a safe environment for the patient, regardless of the patient's current behavior, right? Sometimes the patient is their own worst enemy, but it's our job to see past that, right, and make sure it's safe for him or her as soon as we can. So yeah, Anthony was a really good guy to bounce things off because he came from that world and now he was in the healthcare section. So I was able to go to him and say, hey, tell me about this, I'm missing this, or I got this type of feedback and it really took me back, so it was really very, very helpful.
Absolutely. And I think that's the beauty of having someone who's already kind of been there, done that.
Yeah, I agree. And it was helpful to me. Yeah, for sure.
One of the things I learned from one of my mentors was in those situations where you're working towards something, you have a goal that makes perfect sense. There could be reasons, that you're not privy to as to why they don't, they're not going to get approved right away. One of the things that I learned from him was, even if you get 50% of that goal accomplished, that's a win. Yeah. And then, the next time you have a crack at it, you're trying to build on that. So you can still work towards your goal. You may not get everything that you want at once, but you can still kind of build on the progress that you have made.
Yeah. Yeah. And that's a great point because in law enforcement and military, your end state, you want 100% of that, right? Because you can't be wrong, right? In those instances, you have to be right 100% of the time. So you get there and you want it all. You don't do it incrementally, but that's a really good point because that's the best way to go about it because you're not going to probably get everybody or everything that you can see clear as day as the absolute solution to the issue, But as you said, win a little bit here, next time win a little bit more, and then the next time win. I really like that, and it's so true. It's so true.
Yeah, and it's funny because for me, I didn't think of that, and with my work, with my career, or putting forth a plan like that, making a business case. But in life, when you have a big goal, that's how you have to chunk it down. You can't do it all at once usually.
Yeah, no, that's a good point. Yeah, absolutely.
Now, were there any other challenges coming from a law enforcement background that you kind of had to adapt to?
You know what it was? It was expectations of the security personnel. When I interview sometimes when they say, what do you think one of your shortcomings is? And one of mine is I tend to be a perfectionist. I'm very hard on myself. I expect and demand a lot from me, and I expect that of my coworkers, and that's not always the case right away. You know, these are young men and women. Some their first job, others they're looking to, as a first step to maybe being law enforcement or EMTs or the medical professional or the fire services or whatever. But just basic things about appearance, command presence, tone, volume, and cadence of your speech, work ethic, coming here on time, leaving on time. 3 words that Bill Belichick always says is, do your job. Really easy to say, but sometimes incredibly difficult to operationalize consistently, right? We all have bad days. So, and I tell that everyone, listen, don't be afraid to make a mistake. Mistakes are happen. And that's where your growth comes from learning from them, so you can't be afraid to make a mistake. So yeah, that was one of the challenges I had personally as far as leadership and management with a civilian population for the first time. But I learned that, listen, they all want to do a good job. They really do, and my job, I thought, was helping them to get to that point where they felt comfortable, empowering them to think outside the box and not to be afraid of it, right? Don't let perfect get in the way of good.
One of the things you kind of mentioned there is something I had to learn as well as a leader, is that, people for the most part have good intentions,
Yeah.
right? I don't think too many people get up in the morning saying, there are some that definitely do, but I think it's the minority of people who will come in with the attitude of, they're going to make their boss's day more difficult.
Right.
Most people just kind of come across it honestly because they're trying and they make a mistake, or it's good that you're creating an environment where it's okay to make mistakes and learn from them, because
Right.
that's one of the biggest pitfalls for people.
Yeah, I agree with that. Yeah, most people do want to do the right thing in very challenging circumstances. They're not there to be malicious in nature or harmful. I think a lot of security personnel have a lot of empathy for those types of patients that come in. I tell them all, everybody's got a story to tell. Some stories are much more tragic than others, but it doesn't make their story any less than yours. It's just different. So try and respect that whenever you can.
And I think another thing that ties into it as well, just given the nature of healthcare and the nature of law enforcement too, sometimes there's just not, you get put in a situation where there's not really a good decision. You just have to kind of make the least bad one and hope
Right.
things work out
Right.
the
Yeah.
best.
Right. Yeah. That's a really good point. Yeah. The least bad decision. Yeah. I agree. Yeah.
Awesome. Now, what we're going to be focusing on is something that you mentioned earlier, which is behavioral health. And obviously, right now, with everything that's going on with the COVID-19 pandemic, I'm sure there's some unique challenges that you're facing as it relates to this environment and the clientele. Could you expand a little bit on some of those challenges and how you're managing them?
Yeah, sure. So Brockton is a town in Massachusetts, and the city, was the second highest percentage-wise for COVID-19 positive patients in the state of Massachusetts, other than Boston. Boston was first, and then Brockton was second. In addition, Brockton is a blue-collar town, hardworking people. You know, we also have a pretty robust behavioral health population and homeless population. Both of those types of populations don't always lend itself to following guidelines such as social distancing, wearing a face mask, getting tested. So those types of clients continued to come into the hospital and really started to present some problems with staff. One was, were they tested? Some didn't want to get tested. They didn't know how to get tested or where to go. Unfortunately, behavioral levels continued to be challenging and complex, which resulted in an order for mechanical restraint for the proper environment of care for that patient. We started to get some pushback from staff, for a couple of things. One, they didn't want to do it. Two, our PPE in the beginning was suspect. We didn't have enough. We then started to reuse and reprocess N95 masks and other things. which didn't lend itself to a high level of confidence all the time. And then the HIPAA regulation, right? We needed more information when that particular patient showed up right away, including law enforcement. So HIPAA the Joint Commission and CMS did loosen HIPAA regulations that allowed that information to be transferred much quicker in a much more, I don't want to say formal way, but a little bit informally, that you could, without any fear of a HIPAA violation or someone, coming down and saying that was inappropriate because it had to do with the COVID testing and things like that. We had one discussion that was pretty frank, that if the patient was particularly violent or aggressive, some staff thought it was okay for them to just let them go, then leave the institution. And our risk management and legal were involved in that. And that was a pretty hard one to get across, but eventually that's what the decision was made, that in those rare circumstances, because of what was going on and the potential for harm, we did make that decision that if someone in the behavioral health was really that combative, aggressive, that we would, allow them to leave rather than escalate it and try and get someone compliant and restrained. Notify Brockton Police Department and law enforcement that they were out there, have them, brought back in. And usually at that point in time, they were much more compliant. So it was challenging for a while for those reasons.
Right. And so you mentioned some of the challenges with HIPAA there and how those were mitigated a bit. And, you made reference to law enforcement. Now, one thing that I did see from some other facilities is early on anyways, they were having some significant challenges getting law enforcement to even respond to the hospital. Was that a challenge for you early on?
It wasn't, but what was challenging was that they wanted to know the COVID status of the patient. And in the beginning, sometimes we would know it, and the staff were incredibly reluctant because HIPAA hadn't been relaxed yet to tell them that. So they were like, listen, I get it, but unless you can tell me that, we're not going to, we can't assist you in the right way that we used to. So at times, rather than coming in and actually getting hands-on with us, tactile, some of them came in and just was there as a presence and tried to verbally engage that behavioral health patient. Usually at that time, if the order for restraints has been made, that verbal interaction is less successful because that person's past that. You know what I mean? They've demonstrated it, and they continue to escalate. So that was a challenge for us, and staff and security saw, well, wait a minute. If law enforcement doesn't want to help, why are we doing it? How come you're making us do it? What's the difference here? So it was a challenge, and it was addressed with the reduction or when HIPAA was relaxed, that we could share that information in a timely manner. Law enforcement then would, we'd help them with their PPE and things like that. And then security felt much more comfortable in their role as well when those types of patients were involved.
And that's a classic example too of how we have a lot of things that are black and white, but when it comes down to it, at the end of the day, sometimes in healthcare, you have to really be able to work in those gray areas and just make things work without breaking any rules. But, you may have to kind of, may have to be creative.
Yeah. Things get bent a little bit. You know what I mean? Right. Again, a good friend of mine told me highly successful people, they get comfortable being uncomfortable, right? Because that's where that growth comes from. And those are those circumstances, right? That we are so conscious about our regulations, about the Joint Commission, CMS, especially with behavioral health populations, that 482.13 in the CMS, that regulation is one of the biggest ones for restraints and seclusion. And people are keenly aware of that, because you can have some adverse action, even if it was unintended, even there was no malice there, but there was certainly something going on. Maybe we didn't follow the regulation. So people were skeptical about modifying those things because they have been drilled in their head so many times that these are the things that we have to do. And some of these are things we can't do, and as you said, that gray area became larger and larger a little bit during this COVID thing. It really did, so I agree with you.
Yeah, no, it definitely has a way of growing.
Yeah.
No, one thing you touched on earlier, as well as with some of your clientele, there's a reluctance to actually get tested. Yes. Now, when we had spoke earlier, you'd mentioned that there was a program actually where there was a community outreach program where people were getting tested. Can you talk about that a little bit?
Sure. So our CEO at the hospital was in contact with the city leaders and the state leaders. We had a difficult patient, and the president actually, came down and sat in on a debriefing. And as a result of that, he personally contacted the mayor of Brockton and said, hey, here is our issue that we think is going to continue, if not get worse. As the weather gets better and people start to migrate outside and congregate more, or as the homeless shelters become more and more filled and patients are not getting tested, but yet they can't socially distance, what are we going to do? And we need some help from the state and from the municipality. So they set up an off-site testing free with transportation, and they work pretty closely with all the social agencies that here in Brockton, the outreach communities. Sometimes there's a paranoia with that population, and it isn't always accurate, where they thought if they were tested, the government would know about them, whether they were legal or illegal status, they would know about them, which is a pretty big concern just in their minds, So all that was addressed, and the offsites really helped that. And again, with the relaxation of HIPAA, we were able to get that information, in a timely fashion, and also provide it to law enforcement if we needed to do so. So again, that was incredibly helpful and a big step. But that was one that was fairly understood by everybody. They understood the uniqueness of the population, some of the challenges trying to get the population, the concerns of the population, whether it was right or wrong, but it was their perspective about Big Brother watching, and then how to get them to the sites, and then how to share that information in a timely manner. So that went fairly well. I was pleased with that it did not take a lot to convince anyone. It was just a matter of everybody coming together, how and operationalizing what we needed to get done.
Excellent. And now the other question I'd have is specifically about your facility. Have you had any changes to any policies or practices as a result of everything going on right now?
So as you can well imagine, this COVID-19 presented itself with unforeseen challenges, staffing, operational, regulatory in nature, physically changing over floors to COVID-19, right? Making them negative pressure rooms and some other things. We added about 37 cameras on a couple of floors, so we could limit the amount of times that the staff member had to go into a COVID positive patient's room, and we added audio to that. So if the patient was still able to speak, that was helpful. Unfortunately, those patients that were on ventilators, still required many contacts with staff members going in and out of there. But sometimes the change, the modification, the improvement of policies can take a lot of time in healthcare, right? Where there are a lot of committees and there are very passionate opinions and points of view on usually every particular task that you're looking at. So we're in that process, and I say process, it's a process, of drafts, of redrafts. And then obviously the other part of that is our risk management perspective and our legal perspective to make sure that the changes we're making in that is appropriate and will still be in compliance with whatever the Joint Commission and CMS. I think there are going to be some changes from the Joint Commission and CMS anyway coming down as a result of that. I think they're in the same boat of modifying, like even we're in the window for our survey, and we've learned that some of the surveys now, and they've trialed it a couple times, are done virtually. I think that's probably going to be something that will happen, and probably going to be a hodgepodge of both, maybe some virtual aspects of it, and then obviously you got to come in and do a hands-on at times for the survey to look at where you are, penetrations in the ceiling, and other things that aren't going to go away. But the process of modifying policies and procedures and that type of thing is ongoing. And I can see it taking a little bit to make sure their opinions are valued, taken into consideration, come into that draft, and then running it through risk and legal as well.
Right. And one of the things you spoke to earlier was perfectionism. I feel like there's always an element of that when these policies are being completed. I think people forget that, you can have revisions. Sometimes it's just about getting something out there that people have to work with, have that framework.
Yeah.
What are your thoughts on that?
Yeah, no, I agree. I think policy just that. They should be a guide, right, that give people direction. But as I tell security here, and sometimes when we have a debrief, the emergency room nurses, you still have to critically think through those things and interpret data, right, and make decisions based on what the policy is. And again, don't let perfect get in the way of good. So yeah, that I agree with that. And sometimes you've got to make those adjustments.
Now, one tool that you mentioned that was helpful was actually Elmo. Can you talk a little bit about that?
So we had some senior level meetings, and after one, I was approached by a very high level administrator asking to talk with me. And he said, Scott, how do you think the meetings are going? I said, well, they're going productive, but at the same time, we have a lot of talk going on and no real decision being made. And I said, people's opinions are important, but we've used a term called Elmo, enough, let's move on, right? So we don't get stuck on one thing. And he liked it, and we actually brought in an Elmo giggle doll. It sounds silly, but people were apprehensive about it at first. But as it got in, it became pretty fun to do. And who was the first one that was going to get Elmo, and who was going to, hear Elmo giggle on his thing? But it does two things. One, it certainly stops it, but two, it brings down that compression, right? When you hear that doll kind of giggle, everybody just kind of stops and reassesses and like, you know what? Yeah, enough. Let's move on. We can beat this to, this dead horse, but yet we're not really addressing, the big concept of where we're getting. Again, don't let perfect get in the way of good. It's not that it's unimportant, but let's move on and see if we can't come to a conclusion in a better, more succinct way than getting stuck, right, on this one. Usually it's a very minor issue. That's the other thing. We can all agree most of the time on the big issues. It's the little minutia that sometimes get in the way. But Elmo has been successful, even though at first it was kind of odd. Now it's become ingrained in that, as I said. And it decompresses everyone if it starts to get really bogged down in the weeds. It's just a way to move on in a fun, interactive way. Anybody can push the Elmo, and you don't take offense to it when it does. So yeah, it's worked out well.
I love that idea, and I think it is a great way to lower tension.
Yeah.
Unless, of course, you have a lot of little kids at home, maybe it's a a way to increase your tension.
True.
Now, is there anything? I know we've covered quite a bit here. Is there anything that I haven't asked you yet that you wanted to touch on?
I just think what's coming down. Most think there may be some type of a second wave during the flu season coming in. People won't be outside as often, and what's that going to look like? There's some concern about the pediatric population, if that enhances or if they start to become more affected. Where are we going to put them? Our label and delivery unit, I'm making some changes there. You traditionally don't have a lot of negative pressure rooms there, and if you've got a C-section and things like that, that runs its own, type of concerns. So again, it's just trying to predict to the best of our ability what this flu season is going to look like, getting staff prepared for it. One of the things that we had to do here were there weren't a lot of respiratory therapists, and yet during our highest peaks, unfortunately, there were a lot of people on vents, and we didn't have the staff right away to, manage them and make sure they were operating correctly and all those other things 24/7. So that's one of the things that the Brockton hospitals look, co-training some people to do that if we have that surge again. That's things like that.
Excellent. And from a personal perspective, what can we expect to see from you moving forward?
Oh boy, I think again, that perfectionist in me, I would really like on a personal level to see if I can't get our security staff here to where we're a best practice and we're looked at by other organizations. You can think of just in Massachusetts, right? We've got Mass General Hospital, Brigham and Women's, Dana-Farber Cancer, Faulkner. There are a lot of high-level hospitals here, world-renowned. The security programs are really good, but they're always looking to improve as well. And that's what I'd like to do, is to make sure that our system gets that way. And maybe they look at us now and, hey, Scott, what are you doing for this? How did you do that? Or how did you accomplish that? Have you done any new technologies? Or what's your recruitment? How are you recruiting these people that you're getting and keeping turnover down to a minimum? That type of thing. I think that's always in the works, right? That road to construction and perfection is always under construction, right? The road to perfection is always under construction. You're always looking to improve what you're doing. And for me, that's the challenge that I like, involving the staff, making those little improvements, getting to that point where now we're a best practice and people looking at us for guidance or suggestions. How'd you do that?
Awesome. Now, do you have, before we wrap up here, do you have a special message for the Healthcare Security Cast community?
I do. Listen, that job of hospital security at times can be overlooked or taken for granted. When the code silver or code gray or, BRAT, whatever acronym you use to have security come, staff are looking to you for solutions. Sometimes staff don't always recognize the things that you do and the teamwork that you have and the empathy that we have for those types of patients or family members or whatever. So keep doing what you're doing. It is appreciated. Sometimes it is a thankless job, but always remember, you're going to make a difference whether they tell you that or not in someone's life. And it's with a population that probably needs that type of understanding and a little kindness to help them in what they're doing, right? Sometimes our behavioral patients are their own worst enemies. Everyone has value. Just remember that, because you do a job that's difficult in a very, very complex environment. A lot's expected of you. Just move forward and keep that in your heart that you're doing the right thing. And I think you'll be fine. And I appreciate all that they do on a daily basis.
Excellent. And how can we connect with you, Scott?
So I'm on Facebook and LinkedIn. My company webpage is currently under design. I've got a couple modifications coming in. It takes some time. As I said, I'm not always, I will draft something, redraft something, look at it, make changes. So I'm getting close to it. So the Hemingway Group LLC on Facebook and on LinkedIn. And my email, I'm always on email. It's the Hemingway Group LLC @gmail.com. And Hemingway is spelled HEMINGWAY. So it's the Hemingway Group LLC @gmail.com.
Perfect. Thank you so much for your time, Scott. I appreciate it. And I'm sure hopefully everybody got as much out of the conversation today as I did.
I appreciate that. Thanks so much. And I'm honored that you thought about me, and I'm honored to have taken part in this podcast with you. It really means a lot.
And this concludes another episode of the Healthcare Security Cast. Join us again on Monday, August the 3rd, when we're joined by Sarah McVannell. We'll be discussing her new book, Rockstar, which gives a framework for recognition for healthcare leaders. And that episode will be followed on Tuesday, August the 4th, when we're joined by Marilyn Hollier. Also, I'd like to encourage you to engage with the Healthcare Security Cast on social media. You can find links to all of our platforms on my website, which is Brian, BRINE, Hamilton.com. Thank you again for joining us today. Until next time, stay safe and take care.